Mitral valve is like a parachute. It has its leaflets and its strings, and the blood will go one way and keep going forward towards the rest of the body. In mitral valve regurgitation, which is basically a leakage of the mitral valve, it's one of the most common valvular problems in the elderly. What happens is the valve becomes leaky. As it tries to close, it leaves a hole which allows the blood, as the heart is squeezing, to be pumped backwards. So when you have this problem, it actually is the worst valvular problem. It's very poorly tolerated by the heart.
I get a phone call and they said the echo isn't fine, which just totally blew me away because I felt fine. I had mitral valve repair in June of 2013. She put her heart and soul into that, as my husband said when he came back. When she came back to talk to him, she said she was exhausted, but you could tell she just, put everything into it, and here I am, and I'm doing great.
She was a patient who was so-called asymptomatic. So this patient had a bad leakage of the valve, and the thing about this valve is it doesn't get better. Once you have it, it gets worse. So waiting really gives you no benefit.
And I thought, wow, she's only 38 years old, but she had the experience to get in here and fix me. My husband loved her from day one, and but the more I talked with her, and we looked up all her credentials and talked to people who had actually had surgery with her, and she was the one,
I trained in Harvard, which is a program that's very strong in mitral valve surgery. And mitral valve surgery is sort of a new field in cardiac surgery with the development of repair techniques. Previously, a lot of the mitral valves were replaced, and now there's new evidence that repair is better than replacement. Mitral valve disease is one of the most common valve problems. There are millions of patients that are affected. Many of these patients are not even referred to a surgeon for evaluation. So there is marked undertreatment, there is marked non-compliance with the guidelines. So we have a lot of work to do.
We were at a Cardinal game, I don't know, last spring, and there was a big, lots of stairs, and I just slipped right up those stairs, and I couldn't do that before,
Everyone wants to do everything on a global scale. I want to just change everything from the top. I want to have, from now on, this is what we're going to do for patients with mitral valve disease. But obviously that's not realistic. You have to start small, and how better to start small by basically improving the care of my own patients.